Hello everyone. Welcome to another edition of Fitterfly webinars. My name is Dr. Nilesh Pandari, and I head physician partnerships at Fitterfly. Today's topic is non-surgical approaches to obesity. A recent ICMR India-based study in 2021 measured the prevalence of metabolic disorders as well as obesity in India, and the findings were shocking. So besides the 100 million plus that we see in diabetes prevalence right now in India, it also showed us that there were 254 million people who had generalized obesity in India and 351 million people who had abdominal obesity. So the reason we wanted to do this particular webinar is there are now so many new blockbuster drugs coming into the management of obesity and overweight. Nutrition has always been a mainstay of treatment for sure. And then we also have behavior therapy, which plays a huge part in weight loss. So now we wanted to do this webinar to find out what is the current state of obesity management in India. I would like to introduce the speakers. We have with us Dr. Chitra. Dr. Chitra is an endocrinologist from Bangalore, passed out from Bangalore and Chennai, and then did her DM in Endo at PGI Chandigarh. So she's currently an associate professor of endocrinology at MS Ramaiah Medical College. Welcome, Dr. Chitra.
Good evening to everybody who's joined in. Thank you, Dr. Nilesh, for that introduction.
We also have, thank you, Dr. Chitra. We also have with us Shilpa ma'am. Shilpa Joshi ma'am is a metabolic nutritionist of renown across India, and she heads metabolic nutrition at Fitterfly. Welcome, Shilpa ma'am.
Thank you so much. Thank you very much for the introduction. Good evening, everybody.
Acha. We also have with us Ms. Neha Verma, who heads the mental well-being department at Fitterfly. Welcome, Neha.
Hi, good evening, everyone. Thank you, Dr. Nilesh.
So first, Shilpa ma'am, I would like to start with you, mainly because nutrition has always been the mainstay of weight loss. So could you just give us an overview of how important nutrition is in weight loss, and what are the current findings in how we use nutritional insights to get weight loss?
So first and foremost, obesity, although it is a multifaceted problem, we know that essentially it is caloric excess, and why caloric excess happens and why is the expenditure less has many, many reasons. And there is a lot of hormonal angle to it as well. But ultimately, it is all about how many calories are taken in versus how many calories are put out. And therefore, calorie in, which is coming from nutrition, becomes very, very important. Now, if you look traditionally, nutrition is a science which, in my version, goes through fashion trends. So when I was a student, it was fat was bad. And then now carbs are actually like giving bad words. So, when we talk to people about that you ate carb, then people actually look at you, oh, really, did you? So, it's like almost like a bad word. So what one needs to understand is while diets come and go, basic understanding of nutrition is very important because most of the studies around various dietary compositions are short studies. They are 6 months, 1 year, at the most 2 years. So if you see nowadays, there's a lot of talk about ketogenic diet, very low carb diet for management of diabetes, for management of weight, so on and so forth. But if you look at the duration of these studies in the recent data, it is 1 year at the most. Some studies go up to 2 years. And we know that obesity is not a problem which can be tackled over in 1 year or 2 years. In fact, a weight loss is a weight loss only if it is maintained over a long period of time. Otherwise, that weight loss really doesn't have meaning, and it's only a yo-yo. You lose weight, you gain it. You lose weight, you gain it, and it complicates the whole situation. And hence, any kind of diet which talks about drastic reduction of a nutrient, whether it is low fat, low carb, or very high protein, you will see that the sustenance is very small. And hence, what is really important is eating a balanced meal, because that ensures a long-term sustenance and therefore caloric reduction. And interestingly, couple of years back, it's not a recent paper, it must be a paper around 2015 or so in New England Journal of Medicine, where they actually assessed all kinds of diets in the market. They assessed low carb, low fat, Weight Watchers, so on and so forth. And what they found is all diets cause weight loss. Weight loss is a function of diet being followed, not the kind of diet being followed. So it's very important to follow something rather than follow something and unfollow and refollow. And therefore, it's very important that a hypocaloric, basically, it's all about how many calories you consume. So hypocaloric, well-balanced diet is sustainable and it has stood the test of time.
Very interesting, Shilpa ma'am, that that sentence you mentioned, it's not whether you follow a diet or not. I mean, any diet you follow will give you weight loss if it is followed well, dedicatedly. So thanks, Shilpa ma'am. Dr. Chitra, I'll come to you now. Drugs are the magic pill, the panacea of everything. And now we have blockbuster drugs in the market now. There's a new drug being launched every month, every 2 weeks. Pharma companies are making billions. So what are these indications where you could use drugs actually in weight loss? Are there any indications specifically where you need to go for a surgery? And are there any indications where you could try drugs? Dr. Chitra, you're on mute if you're speaking.
I'm very sorry. So Dr. Shilpa highlighted one very important aspect of obesity itself. Obesity is now recognized that it's a chronic medical condition, and that's something for us to understand, because chronic conditions need continued, sustained care, right? For example, you and I both know that diabetes treatment cannot be taken for 10 days and then stopped after that. Similarly, hypertension medications cannot be taken for a few days and stop. Similarly, obesity needs continued care. And the foundation for any obesity management, including pharmacotherapy, as Dr. Shilpa highlighted, is again behavioral modification. I know that we have an extremely experienced person in the form of Dr. Neha to highlight aspects of it. But while it traditionally still remains calorie in, calorie out, our practices and attitudes, availability of food, access to food, our, let us say, triggers for eating, all of them have changed. Our packaging of food has changed. Our the extra bits that go into making food attractive, all of that has changed. So there are numerous factors contributing to obesity. It's not just an endocrine or a hormone abnormality. So people come to us thinking that I can fix the hormones and then everything will become all right, like we fix hypothyroidism. But it's now recognized that it's a neurobehavioral disease, right? So that's how complicated management of obesity is, which also makes drugs which are used in the management of obesity extremely, extremely tricky, and things that we have to use carefully, because we've had a long list of behavioral medications which have been used in the management of obesity, where we've had worsening of certain side effects in the form of depressive symptoms or even self-harm. But the new class of medications which are available for use, which the whole world is talking about, are a class of medications referred to as GLP-1 agonists, which are medications which were pioneered for the management of diabetes in individuals with type 2 diabetes. Not all diabetes, type 2 diabetes. One of the important things which they noticed when they started using these medications in people is that it had a profound effect in suppressing appetite. And if you see, there is a very distinct difference in the relationship with food with people who are obese and people who are not obese. And what this medication does is that the high that you get, or the thrill that you get after eating food, is completely gone. The reward sensation that you get is completely gone, which means that you're going to feel full with very little food, and you're not craving tasty food, and you're feeling satiated with food, which normally you would not have found satiating at all. So that is completely appetite control. But this is at a center which is slightly more at the level of the hypothalamus and not at the cortical and subcortical levels. So with these medications, you're not really concerned about depression or self-harm or mood changes as a concern. But this class of medications come with a small baggage of side effects which could be related to the intestine, because these molecules also act on the stomach and slow down the stomach emptying, also act on the level of the pancreas, increase your insulin production and decrease your glucagon secretion. So there's a small increased risk of pancreatitis. These medications in India are approved for use only in individuals who have type 2 diabetes and obesity, and not for people who have no diabetes but with obesity yet. The regulatory bodies are relooking the evidence. We now understand abhi to mana hai ki obesity is a chronic illness. So the regulators are now likely to approve it. Earlier, these molecules were only available in the form of an injection, either every day or once a week. And now, for the last about 9 or 10 months, we have these molecules available in the form of a tablet. But the foundation is still behavioral changes. And this will be like the second layer we build on top of it, the drugs. So many people do come to us looking at drugs, like you said, like it's a panacea or it would fix everything. That is something to remember. Second, the minute you go off the medications, there is going to be a regain in weight. That's called the Nike sign or the tick mark sign. There is a slow and gradual regain of weight which happens, which again highlights the fact that obesity is a chronic condition that needs sustained efforts for the management, which essentially means technically the medications for obesity is something that you continue, right? So that's one. So I'll pause and I'll hand back over to you, and we'll talk about the other drugs maybe in another round.
Right. I'll come back to you, Dr. Chitra. Dr. Neha, coming to you. Behavior therapy is a very, very important part of weight loss and obesity management. Just drugs or nutrition does not help because it can't be sustained for a long time, especially nutrition. So I wanted to ask you, Dr. Neha, how does behavior therapy contribute to weight loss? And could you give us examples of some effective techniques in behavior therapy for weight loss?
Sure. So, very rightly said by Shilpa ma'am and Dr. Chitra that it's important to follow something, and it needs to be a constant effort, a consistent effort that one needs to keep putting towards their weight loss goals. And behavior therapy is something which can actually do wonders. I would like to take up lines from what Dr. Chitra said, that what that pill does to you, that drug does to you, is it slows down your appetite. You start feeling full with less quantities of food. And that satiating feeling or that reward stops coming in. So the same effect can be created with something called behavior therapy. And we've tried it, we've used it with people, and we've seen that impact without a pill. So I would say that yes, behavior therapy definitely works. Let me tell you how it works. So behavior therapy is nothing but trying to condition your mind to act and behave in a certain way without making too much of effort. Conditioning happens over a period of time. So you need to repeatedly keep doing something for a period of time for it to start happening naturally. That's how your mind starts getting conditioned towards it. And we all know that weight loss requires consistency. It requires adaptability to various changes around you. It requires a lot of motivation and willpower and discipline. So when all of this is put together, initially people have a lot of excitement and enthusiasm. They tend to follow everything, but after a few days, they go off track. And this is because of lack of consistency. So, and this is why also losing weight is considered to be a very difficult task. So one such technique which me and my team have been using very extensively with our members is called intensive behavior therapy, IBT, commonly known as globally being used as a technique for weight loss. And here we are helping. So how IBT came into picture is when we understood what people actually need help with when they are trying to lose weight. So they need help with managing their time effectively so that they can prioritize their health over other important things in life. They need help with proper planning and preparation, along with structuring their routine so that they can build consistency with their diet or their fitness routine. They need help with setting realistic health goals, which can be tracked and monitored over a period of time. They also need help to manage their junk food cravings or sweet cravings or emotional eating habits, where emotions govern their actions and they end up eating something and then there's a lot of guilt around it and the vicious circle continues. They also need help with managing stress and anxiety, which is associated with the fact that they're trying to lose weight. There is so much to do, and whether they will succeed in it or not. And most importantly, they need help to stay motivated throughout their weight loss journey. So, all of this put together is a part of IBT, where we help people manage all of these situations or problems that keep happening on a daily basis, so that they can build consistency with their diet plan. So, like what Shilpa ma'am said, that it's not the type of diet which is more important, but to follow something. And in combination to that, if you're following the right thing, then I think a combination of a, a good plan which works on your body and behavior therapy can work wonders. And we keep using different combinations along with IBT, especially mindfulness based interventions these days, which help you to gain more control over your thought processes, gain more control over your attention and concentration, and also bring in that wisdom where you can decide for yourself what is right for me, what is wrong. You can make the right choices. You don't give in to your emotions and excitement that easily and quickly. And you also bring in so much of patience in your mind and your body that you can feel satiated with less quantities of food as well. So yeah, that's how behavior therapy works, and we've been using this technique practically speaking. So I know that yes, it has very good positive impacts.
Thank you, Dr. Neha. Uh, you have explained something very important to me. Now, I had another question for you, Dr. Neha. So, I understand the importance of IBT. How difficult has been for your department to work along with doctors and along with the nutrition department to actually effect change? Has IBT been picked up by the doctors very well, or still it's an outlier management strategy for many doctors?
I would say that many doctors are now aware of IBT. They are aware of different components of IBT, and they are also aware that IBT can be used to manage not just obesity, but various other health conditions like type 2 diabetes, like hypertension, like liver diseases, heart diseases, and so on. So it's not very difficult, but yes, more and more doctors need to be made aware of the incorporation or the interdisciplinary approach of using psychology and its principles into management of lifestyle diseases like obesity. And as far as working with the nutrition team is concerned, nutritionists very well understand what will work with the type of body. And a psychologist can very well understand what will work with the mind of this individual. So when these two professionals work together, the mind and body both can be sorted very nicely. So in Fitterfly, we've been working as a team very, very cohesively to help people lose more weight with this combination of expertise.
Thank you. Dr. Shilpa ma'am, your thoughts on the same thing. How difficult it is for these three interdisciplinary approaches to work together?
I think all of us are in agreement, when Dr. Chitra spoke and Neha spoke, that obesity is not a simple problem, like there are a lot of facets to managing obesity, and what makes it more challenging is the chronicity of the problem. You're not looking at, like Dr. Chitra said, you're not looking it at a week or 1 month or 1 year. It's hands on, or it's infinite, and therefore I think it's now more and more papers are showing that any kind of metabolic health issue, would require a lot of intervention, psychology based intervention, because it's very easy to go on a diet for 15 days or 1 month or 2 months, or it's very easy to take a gym membership for 6 months and pump the iron, but it's really difficult to keep it up after that. And we all know, whether even medication, we see that even with medications, that people are all over, all charged up when they come back from the doctor for 6 months. And if they don't go back, then sometimes, they sort of titrate their own medications and go one pill down. So any of these problems we know will require, we will require a lot of psychological intervention, and, just for them to keep up with the problem, being mindful that there is a problem and that you need to follow up with a diet, you need to follow up with exercise, need to take drugs regularly. And I think this is something that the disciplines among themselves, like Neha said, we understand that a diet can be followed only as long as you have a strong mind to follow it. It's not just the diet on the paper. That's the easiest thing. The most difficult part is to swallow it. So, or even the medication, writing a prescription versus seeing to it that I'm taking that medication every single day, or even exercise prescription. It's very easy to give, it's very difficult to follow. And I think for that, we need a multidisciplinary approach. And I think that, everybody who works in the field of metabolic health has come to a conclusion that if we work together, we are only going to help our patients better. Yes.
Thank you, Shilpa ma'am. Dr. Chitra, coming to you, how well accepted is psychology in obesity management amongst doctors?
I think the world is waking up to understand this. So far, the medical world has been a little cautious about labeling obesity, because just like a few years ago, we were cautious about how many pregnant women should be screened for diabetes, how low should the cutoff be, right? Many doctors fought saying you all are over medicalizing pregnancy. You are creating a whole lot of, anxiety to patients. But we now have solid evidence that even a mild increase of sugars in pregnancy can affect the child. Similarly, we are now beginning to understand that obesity is probably, unfortunately, the condition which, if left unmanaged or untreated, could lead to numerous metabolic conditions which can significantly affect lifespan, also quality of life. So now we have solid evidence that you don't treat obesity based on maybe a particular number of BMI or particular waist circumference even. We now pay attention to the entire person, right? So you look at whether the weight is affecting their mental health, the weight is affecting their physical health, right? Whether you're able to move as freely as you want to move, do you get breathless when you climb stairs, do you have pre-diabetes, pre-hypertension? So if you have any of these, you come under stage 1. So if you are maybe not stepping out to meet your friends because you are not happy with the way you look in clothes, that is stage 1 obesity, right? So we are clearly aware that people with obesity are more predisposed to emotional turmoils and mental health challenges. So stage 2 would be probably the people who reach out to Fitify, people who have type 2 diabetes, or people who have hypertension full blown. Stage 3 will be people who have had a heart attack or who've had a kidney disease. And stage 4 would be where they're really needing continuous support to stay well. So we're now aware that you might have people who might be of BMI 38, but who might be stage 1, right? And you might have people with BMI of 29 who might be stage 3 or stage 2, right? So we are now understanding that obesity is heterogeneous. We are understanding that the same mental health challenges might not be there in all people. Like Dr. Neha might have identified that one particular patient might need one particular aspect to be tackled better than obesity. But as physicians, we've clearly understood that management of obesity is not easy at all. We thought if we brought on nutritionists alone, it will work. And we now clearly know that nutritionists and endocrinologists are inadequate to manage diabetes comprehensively. We are clearly aware of it. As are patients. Your patients now will ask you to put you on to a psychologist, or I like to call them behavioral therapists, right? Who help you make behavioral change easy. Nobody taught us how to make behavioral change, right? Even like an inkling into it seems so interesting that it's important to pay attention to how big a goal you're setting, what steps you are breaking it down into, nobody taught us that. So when you tell them go walking or eat healthy, you're not giving them adequate tools. All physicians understand that. So we know clearly that there is a role of a behavioral therapist in the management of obesity, because it is a neurobehavioral disorder at the end of the day.
Thank you, Dr. Chitra. So I'll come back to you for the pharmacotherapy part of it. So I realized that drugs like semaglutide, which have come up as a GLP-1 agonist molecules, they are not used in India, at least on the label, for weight loss. But have you seen off-the-label use of these drugs for weight loss in India yet?
I'm not going to answer that question, but it's approved for use in people with type 2 diabetes, right? So you can use it for people who have type 2 diabetes. It's not approved for the use of obesity because the dosage that is prescribed for obesity is slightly higher. And we as a country have to now evaluate dosage for our population separately. We are aware that, you know, women need smaller doses. We have smaller organs. So we have to find our own dose which might be useful for management of obesity. And that is ongoing. And it's okay that our regulatory bodies are taking some time to review the literature to make sure we're not prematurely, approving drugs for management of obesity. But one approved medication, which is probably underutilized slightly, is a medication called Orlistat, which has been in the market for a while. It is not a very potent medication, but it does cause a reasonable amount of weight loss and weight maintenance, which can happen. It does come with a lot of GI side effects, does not do anything to appetite suppression, clearly inhibits the absorption of fat from your food into your intestine. And that is approved for use in obesity. Another class of medications which can be used in people with diabetes for management of weight will be a class of medications called SGLT2 inhibitors. They are not very, very potent weight loss medications if you compare them to GLP-1 agonists, but they are quite reasonable. And you have maybe 10 to 15% of people who are super responders who lose quite a bit of weight on it. So that class of medication is available. Metformin, weight neutral, not a major, but in some people it can cause significant weight loss. We have many, many newer drugs in the pipeline. We have dual agonists, GLP and GIP agonist, tirzepatide. So far, with the largest weight loss documented ever, published about 11 months ago, to the tune of 25% weight loss in people with obesity, with or without diabetes. We also have another molecule, which is CagriSema, semaglutide in combination with cagrilintide, which is a amylin peptide analog. Again, these are exciting times. And there are triple agents which are being tested out. There's a race on between all the companies. So GIP, GLP, and glucagon-related molecules. Glucagon also plays a huge role in satiety. So all of these molecules come from the incretin family, and they all primarily work through appetite suppression. So I shouldn't say these are exciting times, but obesity management is clearly, there is a need gap, which is trying to be addressed by the newer pharmacotherapy molecules which are in the pipeline.
Thank you, ma'am. So, as you know, as the audience will also know, that Fitterfly works in the field of digital therapeutics, where we try to use technology to affect better outcomes in obesity and weight loss. So I wanted to ask the panelists over here.
So can I ask you a question, Dr. Nilesh?
Yes, please, ma'am.
So how does Fitterfly help with weight loss? So if I refer a patient over to Fitterfly, tell me exactly how Fitterfly will make the management of obesity better than if I just give a prescription for a medication and send them.
Right. So, ma'am, like we have been speaking for the last 20 minutes, nutrition and intensive behavior therapy are very, very important pillars within weight loss management. Those are the kind of services that we provide through our app, online, through phone calls. So the way it happens is, once you give a prescription to a patient, and you prescribe Fitterfly, something like Fitterfly to them, we call up the patient, and then we take the baseline nutrition, diet, and the psychological level, psychological status of that particular patient at that time. Then, depending on what insights we get from that particular baseline parameters, a personalized program is designed for that particular patient for the next 3 to 6 months. And that program is executed, and all reporting and all assessments are sent back to the treating doctor. That would be you if you have sent the patient. So it becomes a team. You actually get a team to work for you. You being the prescribing doctor, and our coaches giving the advice for nutrition, giving the advice for behavior therapy, and giving the advice for fitness and pain management, which generally happens as associated body aches happen in many of these people with obesity. So we provide the whole support system that you would require to actually holistically treat a patient with obesity.
Thank you.
And we use this using a lot of technology, because you can't have these people coming to you every time with their doubts, or whenever they have any issues. So we do have our app where they can just fill in the diet, and then we can access and find out if the diet makes sense, what is the protein level, what is the carb, how much fats, what needs to be reduced, what needs to be increased. So this is what we do with the technology. So how important do you think in today's day, when everybody is so used to using technology, and which actually has shown us to get us better outcomes, how often do you yourself use treatment like digital therapeutics, and how important do you think it is?
In fact, I think anybody who's seeking care for chronic metabolic health would benefit from support from a digital platform wherever we're trying to change habits, effect changes in behavior. Clearly, yes. But of course, willingness, readiness, cost, inclination, these are also factors which will alter maybe who gets on it and who doesn't get on it. But I'm likely to recommend it to people who are busy, tech savvy, understand the importance of figuring this thing out, right? When they come to us, they're usually lost. Why did this happen to me? What caused this to happen? And so extremely motivated people who are trying to figure this out are likely to benefit. We also have a good number of people who might be elderly, set in their ways, but we see that even they do very well with support in the form of, maybe when they got diagnosed, life was too busy. They never had the time to pay attention to their lifestyle practices, and it caters to a whole bunch of people. You generally tend to believe that young are tech savvy and old are not, but old are probably more amenable to certain conversations that you have and certain changes that you would converse and agree upon. So yes, I think a good mix of people, essentially people who understand that, like Dr. Shilpa said, we should be learning things about ourselves and effecting changes which are likely to be sustained for a lifetime, not for a few months or for weeks.
Thank you, Dr. Chitra. Shilpa ma'am, coming back to you, you have been working with digital therapeutics and metabolic disorders for a very long time now. What do you see as the main USP of using technology like digital therapeutics in these conditions, especially weight loss right now?
So, like we have been speaking, any kind of metabolic issue requires a lot of motivation, and we do not know at what stage the member comes to us at that point. What is very important in maintaining any kind of intervention here is hand-holding. It can be a real hand-holding and it can be virtual hand-holding, in the sense that a person can keep going to specialist every now and then, to a doctor, to a dietitian, to a physiotherapist, to a counselor, so on and so forth. Or because what happens is, this is something that I say, that food is a decision that you make 4 times a day at least. And it's very difficult to be in the right frame of mind 4 times a day. It's a very, very tall order. While we simply talk to our patients that why did you not, or why did you eat a piece of cake or whatever, pakoda or vada pav. It was a decision that person had to make at that point, and we don't know what were the circumstances. So I think such problems require a lot of hand-holding and lot of at that time coaching, what could have been other things that could have been done. And I think that's where a digital program actually takes over in-person coaching, because every time you're not in a position to call up your dietitian or your physiotherapist or your doctor or even your psychologist all the time, you cannot be on phone. And that's the time when you can add things on the app, you know and app can bring out suggestions to you, because that's the way artificial intelligence is sort of uh,
Yeah.
it's made for that. It's made for at that time use. And I think that is something that uh, digital therapeutics brings in, which probably is so different from one-on-one consultation with any kind of specialty.
Thank you, ma'am. You brought up the point that we are actively looking at infusing AI in our digital therapeutics program. We'll come back with more details on that in another webinar, but thank you for bringing that up. Dr. Neha, so has the practice of psychology actually adapted to the use of technology? And how well do you think psychology practice is being used in DTX in Fitterfly?
So, psychology principles, interventions, and techniques are being increasingly used, especially behavior therapy techniques are now being increasingly used by various health and wellness apps globally, I would say. And they are working really well with people because, one, they are not directly, exposed, psychologically speaking, directly exposed to talking to a psychologist without proper mental preparation, because people do have a social taboo in mind that I don't have a mental problem, why should I be talking to a counselor or a psychologist? I'm here to lose weight, so why should I be talking to a psychologist? So app related technology based interventions are able to handle that taboo and not give so much of social tension to the individual who's trying to deal with weight loss. And then these techniques are integrated so well in the form of trackers. And like recently, we launched a mood tracker in Fitterfly app, wherein we are able to now track the mood swings of people, and also bring valuable insights as to what is leading to those mood swings and how their food choices are being governed because of their mood swings. So these kind of insights, when people start getting in their daily life, they also start getting insights about how they can build new habits, how they can break unhealthy habits, what can they be doing. Like ma'am said, that in a particular situation, you don't know what the circumstance is and what governs the behavior of that individual. You may end up eating an ice cream or a pizza at that moment. So technically, if you are on an app, on a digital platform, something like a habit tracker can give you insights of what you should be doing in that moment to avoid eating something like that. So these principles are now getting more and more well integrated into apps. Fitterfly is also one such app which is integrating these principles really well. And I would say that behavior therapy techniques are following various theories, right from Charles Duhigg's concept of habit formation to Combi model of behavior change. We are used and intensive behavior therapy, of course. So a combination of all these techniques, if they are integrated well with technology through a digital platform, as well as there are expert help also available for people who want to have one-on-one sessions, who want to really share and discuss, and issues like depression or anxiety, which are now increasingly becoming common among people who are struggling with obesity. These things require one to talk at a very one-on-one, personal, confidential level to someone who is an expert and who can guide them. So when both these options are available through a digital platform, then I think people are becoming more and more receptive.
Thank you, Dr. Neha. Dr. Chitra, I want to share an insight with you and then throw you a question. So our data shows that weight loss is the most highly prescribed program from Fitterfly by doctors. It is prescribed more often than diabetes programs, even if the patient is a diabetic, but then who's also overweight. So I wanted to ask you, what are your thoughts on this? A much better reception of obesity management using DTX rather than diabetes right now. Do you have any thoughts on that?
Because as a physician, managing diabetes is easier than managing obesity. It's very simple. There are many options available for managing obesity. So what behavioral changes we are not able to effect in the management of diabetes, I have medications to compensate for it.
Right.
Whereas in obesity, you clearly need to change the ways, and we don't really have too many pharmacotherapies available which are approved for safe and continued use. I think that's one of the reasons why people would refer even people with diabetes to your obesity management program. I don't know if you have any other insights which are different from what I said.
No, those are exactly the insights I had. I wanted to listen it from your mouth rather than me speaking it out. So thank you, Dr. Chitra. I would like to open up the...
Can I add a point to what Dr. Chitra said?
Yes,
Yes,
I
ma'am.
think from a patient's angle, no, obesity is not a problem. Diabetes is a big problem. So when you go on an obesity program somewhere, psychologically, patient feels I am at a, my problem is smaller than
Yeah.
diabetes. Diabetes is a very big problem. So,
True,
Correct.
true.
so it's a, I think, and you lose weight and your blood sugar, we know,
Better.
your
Comes down.
insulin resistance gets better. I think it's more heartening for a patient to join a weight loss program than diabetes program. Also, weight loss, for the lack of better word, is more fashionable than managing diabetes.
Yeah, very true. The conversions of patients who actually agree to join weight loss programs is much higher than diabetes care programs.
Yeah.
So people are slightly more scared of diabetes care programs. They like to keep it a secret, still a stigma, I guess.
There is a stigmatization.
Yeah, but
If I can just come in with another, I think they also don't really like to test their sugars that often.
Yeah.
I think this is especially people who are newly detected. They're like, my diabetes is so, I just started. What do you mean by checking sugars for 2 weeks every day after every meal? What is this? Why should I wear a continuous glucose monitor? Now, I'm not so serious. So that is also something that they don't really like.
Yeah, and being on an app for a weight loss management program is still fashionable.
Yes,
And
it is.
yeah, it is. Yeah. So I would like to throw open the panel for questions. Hi, Ashish. Any questions from you? Ashish,
Hi,
unmute.
Dr. Nilesh. A very nice session and multiple perspective of managing weight loss. Very interesting session. No question as such. I mean, understand like more pharmaceutical companies are working on providing medications, but yeah, long way to go, as mentioned by Dr. Chitra. And yeah, I mean, behavioral and other aspects are more important. So very insightful session. Thank you, Dr. Nilesh, like for conducting it, and thank you, the panelists, also for providing such insights into that.
Thank you, Ashish. Daksha, do you have anything to add or any questions for us?
Hi, am I audible?
Yes, you are audible.
Yeah. So it was just a very nice, insightful session, and no questions from my side. Thank you so much.
Thank you, Daksha. Dr. Praveen, anything that you would like to ask or add to this discussion? Dr. Praveen, you're on mute. Yes, Dr. Praveen doesn't have any questions for us. So, Dr. Chitra, मुझे पता है आपको भूख लगी है and you really need to go and eat. But I'll ask you one last question before we all leave. So, if you want us to take away something on the best approaches to weight loss in India right now, what would that be? We could start off with Dr. Chitra, then go to Dr. Shilpa, and then go on to Dr. Neha before we close it.
It's a very difficult question, but if you truly were a person who believed in the well-being of mankind, you would now stop and pay attention to the marketing of food, and then pay attention there, because it starts from there. The marketing so food addiction is now a medical illness or a medical diagnosis now, just as addicting as smoking or alcohol can be. But nobody is flashing 200 pictures of alcohol or cigarettes in your face. You have regulations against it. but there are triggers or cues for you to seek food out literally everywhere. And for a person who's having this constant chatter in their head about food, that is an extremely difficult chatter to kind of navigate through. That's one of the reasons why it's so challenging. But without talking about policy change for obesity management, I think it's important to prevent or catch it early, and maybe probably talk about behavioral changes as units and not as individuals, because it's easier to change as a family unit versus changes in one particular individual, because management of obesity in adolescents and children is an absolutely whole different ballgame. And now it's not uncommon for high school children to be with a diagnosis of diabetes. Without talking about the weight or the BMI, it's not at all uncommon. Currently, we are running a clinical trial for type 2 diabetes in adolescents aged between 10 and 18 years of age, with the same molecules that we were talking about. So that's how serious and significant this is. And children did not make choices by themselves, right? They learned it from the family. So I think that's an important aspect that we could talk about. And I think when one person seeks help to make changes, invariably it seeps into the lives of others. So as a digital platform where you reach the homes of people, I think we have the ability to kind of cascade the learnings into management of obesity at more levels than an individual level.
Agreed, Dr. Chitra. It is the whole family which has to be living with that particular obesity case. It's not just that one person living with obesity. It's the whole unit. Shilpa ma'am, your one thought that you would like us to take away from this?
So, this is National Nutrition Month in India. And this year's theme is Suposhit Bharat, Sashakta Bharat, and Sakshar Bharat. And I think Sakshar is educated, right? So education about these problems is important. Like Dr. Chitra said, that if you want to prevent obesity, you have to understand the saksharta that you want to have here is what is shown in an advertisement is not the truth, and you don't have to seek it. The saksharta here for the mother is running behind a child with food is not good parenting. I think that is force feeding children is not something which is required. I think these are kind of things that we need to talk to our patients, and not just see, once there is obesity, you can only go up to a certain point to treat it. We all know, we all have been dealing with so many metabolic problems, whether it is diabetes, you can only go that much. But prevention is far, far better. And for prevention, we need education, and not the education which comes in just medical textbook or nutrition textbook. I think we need to, like she said, Dr. Chitra said, policies are very important, because that is what the whole country is going to see. But as like we have the beautiful thing that before every movie we show about ill effects of tobacco, right? And that drive actually decreased tobacco consumption in the country. But more people die of obesity and diabetes than tobacco addiction or oral cancers. So in the same theater, we buy samosas for our kids and packets of chips for our kids and popcorns for our kids. So I think if we are going to stop that, we are also going to stop not only diabetes, but not only obesity, but diabetes, but heart disease, so on and so forth. So I think education is very important, and a practical education about what can be done to prevent all this.
Very interesting, ma'am. The point I take from you is education, information, and changes at the policy level to take these as a very important part of public health, which is it's not being done right now. So thank you, Dr. Shilpa, for that. Dr. Neha, your one piece of advice you would like us all doctors to take away from this?
So, being a psychologist, I would say that we should be making people, firstly, as doctors, we should be understanding and exploring on our own, and then making our patients more aware about the power that a mind has. Mind has a lot of power to deal with the toughest of the situations in life. And what matters is how we use our mind in a skillful manner, how we use that power in a skillful manner. So if we can realize the power of the mind, if we can work on it consistently with proper skill set, then we all can achieve our health goals. We can help our patients achieve their health goals. So like ma'am said, education is important. In addition to that, awareness about your own power that you have in your mind can work wonders.
Thank you, Dr. Neha. And I think we can close this session now. Thank you, Dr. Chitra. Thank you, Dr. Shilpa. And thank you, Dr. Neha, once again for joining us for this session. I would also like to thank all the audience and hope to see you guys again for the next webinar that we're going to have very soon. Thank you and good night.
Good night.
Thank you. Good night.
Jai Hind.